This is a very exciting program that we're piloting, and we're working with an artificial intelligence company called Javion. And the reason that's important is that as we're learning how to manage our patients most efficiently under a value-based care of delivery, we really get to a point that we need to identify patients and risk stratify those patients. And so if we can identify difficult or problem patients, if we can identify them early, then maybe we can have interventions that can help with those folks. So we have worked with a company called Javion to where we share all of our clinical and practice information, but they also have a vast amount of data and information that's out there to where for any individual patient that we have, they can explore over 4,000 data points around that patient and be able to use those data points to help characterize that patient and potentially identify certain risk factors with those patients. And so as part of what we've developed with them is we've looked at 7 different vectors, and these are just things that we think can negatively impact patients. So working with Javion, with the artificial intelligence tool that we have, one of those vectors is can we predict or identify which of our patients maybe are going to die within the next 30 days? Because if we know that, then if we can identify those patients, then maybe there's interventions that we can plug into those patients to actually prevent that event from occurring. Or maybe it's in agreement that those patients indeed are in a state where they are likely to die within the next 30 days. And so it allows us to have assurances that we're appropriately talking to them about palliative care and end of life. And so if we agree with some of the data that Javion has identifying those patients, then we can incorporate our palliative care team and get those appropriate care plan visits with those patients to help direct their therapy in that way. There's many other vectors that we're looking at. So if we can identify people that are at risk of having depression and they're going to need to be on antidepressants, we can get those people plugged into our psychotherapist. If we can identify people that are predicted to have increasing debility, where in the coming months that they might end up in the emergency room or the hospital, then we can incorporate those people into our rehab program or our dietitian program in order to optimize their functional capacity and their health. And we can look at certain vectors like that in order to help risk stratify our patients and identify patients that would otherwise we may not have any idea that there's something underlying that's going on with them. And our early data that we have has shown that we have positive impact on those patients, and we can utilize again the information that we have to get our case managers involved and to get those people appropriately resourced to our ancillary services such as psychotherapy, palliative care, rehab, dietitian, integrative therapy, all those things.